countries have reported some 5 million COVID-19 deaths in 2 years. But the global excess deaths are estimated at double or even quadruple that figure. On November 1st, 2021, according to official data, the global death toll from the COVID-19 pandemic passed 5 million. It has now reached 5.5 million. But that figure is a significant underestimate. Records of excess mortality show many more people than this have died in the pandemic. This has been derived from metrics that involves comparing all deaths recorded with those expected to occur. Some official data in this regard are flawed, scientists have found, and more than 100 countries do not collect reliable statistics on expected or actual deaths at all, or do not release them in a timely manner. Demographers, data scientists, and public health experts are striving to narrow the uncertainties for a global estimate of pandemic deaths. The parameters to conclude that deaths are 4 times the official figure are based on methods ranging from satellite images of cemeteries to door-to-door surveys and machine learning computer models from available data. Even superficially, similar places can have varying approaches to recording COVID-19 deaths. Early in the pandemic, countries such as Netherlands counted only those individuals who died in hospital after testing positive for COVID. Neighboring Belgium, on the other hand, included deaths in the community and everyone who died after showing symptoms of the disease, even if they weren't diagnosed. This is why researchers quickly turned to excess mortality to measure the pandemic's toll. Experts say that while death estimates for more than 100 countries are unreliable, China, India, and many in Africa lead this list. That's because those countries either do not collect death statistics or do not publish them in a speedily manner. But they also account for millions of COVID-19 deaths. A true global pandemic death toll cannot be counted without those data. But some researchers argue it is possible to model one. For China, the model estimates almost 750,000 deaths, which is 150 times higher than the country's reported toll of 4,600. The same model estimates some 5 million deaths in India, for example, which is 10 times higher than the country's official COVID-19 toll of less than 500,000 deaths. This means the true death toll of COVID-19 might always be disputed. The world still doesn't know how many people died in the 1918 flu pandemic. But experts always figured they would know pretty well how many people would die in the next one, because after all, we're living in the modern world. Unfortunately, this seems to be wishful thinking, because science could neither save the world from COVID nor let the world know how many lives the pandemic actually claimed in reality. Bureau Report, The Metro.